Hello guys, welcome back again on my YouTube channel. You know our channel is all about eye health, all right? And on our topic of discussion today, I'm going to teach us step by step on how we need to be putting our eye drops, right? Because there are a lot of people, they don't know how to put eye drop, all right? So the very first way is that you need to wash your hands. Wash your hands with soap. Okay, wash your hands under a running tap with soap. Washing it with soap will help to remove the bacteria infections that are in your hands. All right, because during the day while carrying out other activities, you have touched this place that contain bacteria, and so washing your hands will help to reduce the bacteria that your hands or your fingers have accumulated during the day. So you first of all wash your hands very well, thoroughly, and make sure you interwash your hands very well. Even your fingers, wash it very well. Secondly, what you need to do is when you take the medication, all right, check the expiring date. The expiring date is very important because even those that are selling the medication, they do make error, and so you have to check the expiring date of the medication. After checking and confirming and knowing that the medication is healthy, you shake the bottle of the medication very well. Shaking it very well will help to circulate the active ingredient that need to work to that eye condition, because there are some that will set under the bottle, and so shaking it will make it to mix properly for effectiveness. After shaking, this is what you need to do. You look behind. If you don't have anybody to help you, all right, you tilt your head behind. After tilting your head behind, you pull down these lower lids, all right. By so doing, you have already opened the cap of your medication. You pull down this lower lid, and you are going to put it in this Phoenix conjunctival sac. You drop it there, you squeeze it there, one drop. And while putting, you make sure your fingers don't touch the tip of the bottle, because there might be minor infections on your fingers and you carry them on the tip of that medication, and you take the medication and put it in your eye with that infection on the tip. At the end of the day, you contaminate the entire medication inside the bottle, and you increase the infection in your eyes. All right, so you make sure your fingers don't touch the tip of the bottle, neither it touch the inner part of your eye, because if your eye is carrying infection and you take the tip of that medication or that bottle into your eyes, you are going to contaminate the medication. You might even wound your eye. All right, so these are some of the precautions that you need to take into consideration while putting your eye drop. And after putting your eye drop, immediately you drop, and when you are dropping, drop one drop. One drop is very, very important. One drop. After dropping, what you need to do is you close the eyes gradually. Close the eye gradually. Why are you closing the eye? So that the medication will circulate into the eyes and work properly. But by the time you want to close the eye and you just squeeze, you are squeezing the medication out. When you squeeze that medication out, the effectiveness of the dosage will no longer be there. And so that is how healings of that eye condition will be slow. So I'm encouraging you today, when you drop the medication, you close your eyes gradually. Don't squeeze. When you squeeze, you are squeezing off the medication, and that eye condition will be slow to heal. Another thing is that when you close gradually, you are preventing the medication to enter your punctum, all right? Because there are some medication that when they pass through your punctum and goes to the system, it might react to your entire system if at all you are allergic to that medication without knowing. And so the act of closing your eyes gradually is not only for the medication to work properly, but also to prevent it from going into the system, because you are not sure of the allergy or the complication that might come from that medication systematically. So closing your eyes gradually is very, very important. After instilling your medication and you see that there is excess coming down, you can look for a clean cloth, a clean one, very clean, or toilet tissue that does not contain particles, because you can look this sita is very good, or hand napkin, and then you damp the excess that has come out from the eyes. Okay, when you damp, you keep the area clean and then clear. Then another very important thing I want to say is that now there are some people that will have more than 5 eye drops to put. All right, there are some people that will have more than 5 eye drops to put, and there is a big mistake that they are doing. Now you are having 5 eye drops and you need to put them at the same time. This is what you need to do. All right, when you drop the first eye drop, you can make at least 1 to 5 minutes before you drop the next medication. Why? Because when you drop that medication and wait for 5 minutes, that one will be absorbed by the eye and work effectively. But by the time you drop that one and take the next one and drop, as you are dropping the second one without waiting at least for 5 minutes, you are flushing out the first medication. As you are dropping the next one, you are flushing out the second medication. So the effectiveness of each medication to work properly will no longer be there. So when you drop one eye drop, you wait for 5 minutes, 5 good minutes before you drop the next eye drop, so that absorption rate will be effective and the way the medication will work will be effective. All right, you have a good prognosis at the end. So when you drop one, you wait 5 minutes, you drop the next one, like that continuously, and you will see that at the end of the day you have put your eye medication properly. By so doing, that eye condition will heal properly. And don't forget, those of you that you are using medication, when they prescribe you medication in the hospital, when you are back home, you share with your neighbor, you are doing a wrong thing. This is another point that you need to take it seriously. Those of you that when they prescribe you eye drops in the hospital, you come and share with your neighbors or with your friends, thinking that you are doing them good, you are doing a very wrong thing. Because that eye condition that you are having might not be the same eye condition that your friend or your neighbor is having. So don't share your medication with your neighbor or friend. It's wrong. You might even provoke an eye situation and cause blindness to your neighbor or your friend, thinking that you are helping them. So if you have been practicing this habit, make sure you stop it. Okay, stop it. Some will even use eye drop, they keep half to be used another time that they are experiencing an uncomfort situation in their eyes. It's wrong. When you use, if the doctor asks you to use your medication for 1 month, make sure you use it for 1 month and then you throw away. Don't use and keep the half that when you are having another eye condition, you come and take that same medication and use. That potency of that eye drop will no longer be effective because you have opened it, air has entered there, infection has even entered there. So I am begging you, if you are practicing this habit, there is need for you to stop and stop sharing your medication. So I am encouraging you today, if you are coming across my videos for the very first time, please don't forget to share with others so that they can join us on these tips on how to care for our eyes. All right, when you share, don't forget to like. When you like, don't forget to subscribe or ask others to subscribe. Please keep steady on this channel because a lot of tips will be coming in on how to care for your eyes. I love you guys so much. For those that has been partaking, for those that have been asking questions, inboxing me for questions and answers, I want to say you are blessed. God bless you so much. I love you guys.